Hello all, I'm Dr. Gökay Bilgin from Smile Hair Clinic. Today we will delve into our patient's Scott's hair transplant. So first we will check his photos before hair transplantation. You see he needs hair transplant in the crown and also in the front. So he has some hair in between frontal part and the crown, but they are mostly not creating enough density because shrinked in size. So what we try to do is we try to give him a new hairline and increase the density in the crown as much as we can. But I want you to look his donor zone pictures before hair transplantation. So if you zoom in his pictures, you can see there is a shade difference in the bottom part of the donor zone and the upper part of the donor zone. This is mostly his hair in that upper part is also thinning. If you see that shade difference, density difference in the donor zone, it's a major sign that the patient will experience Norwood 6 or 7 hair loss in the future. So these patients always must use finasteride plus minoxidil in the future to avoid more hair loss. So after the procedure, as you see, he is happy. We transplanted 3,750 grafts in total. Of course, our priority was the front and frontal part of the head, and we increased density as much as we can in the crown. So we will go and see 13th day pictures. As you see, his hair looks already denser because the most of the grafts they are still there. He not suffered from the shock loss at the moment, and you can see the redness. As I always tell people that the redness on the transplanted zone really depends from person to person as how long it will stay there. Some people's redness go away in a month. Some take 2 or 3 months to go away. And we will check his pictures in the 3rd month. He had grown some tiny hair in the transplanted zones, but they are not enough in density, also in the texture, to create a satisfying density in this period of time. So the magic really starts in the 6 months. We will check his 6 months pictures. As you see, the hair in the front looks much better, but he is missing some density still in the crown. So we will check the 12-month pictures. Yeah, his hair in the front seems perfect, but his hair in the crown looks same nearly the 6 months. This may be because he also continued to lose some hair in the crown, but I highly believe that if he uses finasteride plus minoxidil, it will come back and he will have a high density in the crown again. And also you can see his donor zone. You can still see the scars of the extraction. As I always tell, they are like the half of the rice. In 1 year they are much more visible because our body heals with a tissue called regeneration tissue, and this combination is much more different to normal tissue you have. So this tissue needs a couple of years to change its composition, very similar to the natural tissue you have, and it will be less visible in the next year or the year after. We had seen our Scott's hair transplant journey in this video, and please do not hesitate to contact us any further information or any questions in your mind.